I'm Dr. Marissa, and today I'm going to show you one morning habit that many adults over 60 do every single day before coffee, before breakfast, before they even think about their heart. They wake up, open their eyes, sit up fast, stand immediately, and walk straight to the bathroom. It feels normal, it feels harmless. You may have done it for 20, 30, even 40 years. But after 60, those first 30 seconds after waking up may be one of the most important moments of your entire day. Now listen carefully. If you ever feel dizzy when you stand, if your head feels foggy in the morning, if your heart races when you get out of bed, if you need to hold the wall, the nightstand, or the door frame for balance, this video is not random. This video may be exactly what your body has been trying to warn you about. Because many people think heart danger only comes from chest pain, but sometimes the warning is much smaller. A little dizziness, a sudden weakness, a pounding heartbeat, a morning pressure in the head, and then they say, I'm just getting older. No, not always. Sometimes your body is telling you that your morning routine is too fast for your heart. Stay with me until the end because I'm going to give you a simple 90-second morning routine that costs nothing, needs no equipment, and may help your heart start the day more safely. Before we begin, type morning in the comments if you usually stand up quickly after waking. And if you are new here, subscribe because this channel helps adults over 50 understand what their body is really trying to tell them. We don't do fear here. We don't do fake promises. We connect the dots. Now let's begin. The mistake is standing up too fast right after waking. That is it. Simple, ordinary, and very common. Your alarm rings, you open your eyes, you sit up quickly, you swing your legs off the bed, you stand, and in less than 5 seconds, your body has gone from lying flat and resting to standing upright and fighting gravity. When you are young, your body usually handles this quickly. Your blood vessels tighten, your heart adjusts, your blood pressure stabilizes, your brain keeps getting blood. But after 60, the system may not respond as fast. Your blood vessels may be stiffer, your blood pressure may already be harder to control, you may be taking medications, you may be slightly dehydrated, your balance may not be as sharp, and when you stand suddenly, blood can drop down toward your legs. For a few seconds, your brain may not get the steady flow it needs. That is when you feel it. The gray feeling, the head rush, the dizziness, the need to hold something, the moment where you stop and think, wait, give me a second. That second matters. Because dizziness when standing can be related to a sudden drop in blood pressure, often called orthostatic hypotension. Mayo Clinic describes this as feeling dizzy or lightheaded after standing up, and it can sometimes lead to fainting. Now here is where most people make a dangerous mistake. They ignore it. They say it only lasts a few seconds. They say, I've always been like this. They say it's just age. But if you are over 60 and you repeatedly feel dizzy when standing, that is not something to laugh off. That is information. Your body is telling you the transition from lying down to standing up is too sudden, and your heart is being forced to catch up. Now stay with me because this next part is very important. Morning is not the same as afternoon. Your body is different in the morning. During sleep, your heart rate and blood pressure often go lower. Your body is resting. Then as you wake up, your nervous system becomes more active, hormones rise, blood pressure begins to climb, the heart prepares you for the day. This is normal biology. But in some adults, especially with high blood pressure or stiff arteries, the morning rise can be stronger. Research on early morning blood pressure surge notes that the rise on waking can be larger with age and is linked with cardiovascular risk. So imagine this. Your blood pressure is starting to rise, your heart is waking up, your blood may be a little thicker because you have not had water all night, your arteries are not as flexible as they used to be, and then you jump out of bed quickly. That is a lot to ask from your heart in just a few seconds. A woman once told me, Dr. Marissa, every morning I feel like my body needs time to come online. That is actually a perfect way to describe it. After 60, your body may need a slower start, not because you are weak, because your heart deserves a smoother transition. Now, the second morning mistake is reaching for coffee before water. I know, for many people, coffee is sacred. They say, Doctor, don't take my coffee. I am not taking your coffee, but I want you to understand what happens first. You sleep for 7 or 8 hours. You breathe all night. You lose moisture through breathing and sweating. You wake up having had no water for hours. So before coffee, your body may need fluid. Coffee is not evil. But if the very first thing you give your body is caffeine while you are already a little dehydrated, your heart may feel that. Some people notice palpitations, some feel shaky, some feel anxious, some feel a faster heartbeat, and they never connected to the fact that they stood up fast and went straight to coffee. Your first drink should be water. Not because water is magic, because your body has been without it all night. Here is the rule I want you to remember. Water first, coffee second. Keep a glass of water beside your bed. When you wake up, sit up slowly and drink some water before you stand. You do not need to force a huge amount. Start with a few slow sips. If your doctor has restricted your fluid intake because of heart failure, kidney disease, or another medical condition, follow your doctor's instructions. But for many adults, starting the morning with water is a simple and helpful habit. Now type water in the comments if you usually drink coffee before water. I want you to be honest. No judgment, just awareness. Now the third mistake is rushing to the bathroom. This one is very common. You wake up and feel pressure in your bladder. You think, I need to go now. So you rush. You stand quickly. You walk fast. Sometimes the room is still dark. Your legs are not fully awake. Your balance is not fully ready. And that is when accidents happen. A stumble, a slip, a fall, a sudden dizzy moment, a hand reaching for the wall. For older adults, falls can change everything. A fall is not just a fall after 60. It can mean injury, fear, loss of confidence, and less independence. And many morning falls happen because the person moved too quickly before the body was ready. So here is what I want you to do. When you wake up, do not jump up, pause, breathe, sit, then stand, then wait, then walk. That may sound slow, but it only takes about 90 seconds, and those 90 seconds may protect your whole morning. If you wake up often to use the bathroom at night, this is even more important. Nighttime bathroom trips are risky because you are sleepy, the room is dark, and your blood pressure may shift when you stand. Use a small nightlight. Keep the path clear. Do not leave shoes, rugs, or cords near the bed. Sit first. Stand slowly. And do not start walking until your head feels clear. Now stay with me because this is where the solution begins. I want to give you the 90-second morning heart routine. This is simple, no equipment, no money, no complicated exercise, just a safer way to wake up your body. Step 1, before you move, take 3 slow breaths. When your eyes open, do not jump up, stay where you are. Breathe in slowly through your nose, breathe out slowly through your mouth. Do that 3 times. This tells your nervous system we are not in danger, we are starting calmly. It may help reduce that sudden rush feeling in the body. Step 2, move your legs before standing. Still lying down, gently move your feet, point your toes, flex your feet back, circle your ankles. Do this slowly. This wakes up the calf muscles and your calves help move blood back toward the heart. Think of your legs like a pump. Before you stand, switch the pump on. Step 3, sit on the edge of the bed, roll to your side, push up slowly, sit with your feet on the floor, do not stand yet. Stay seated for about 30 seconds. Notice how you feel. Is your head clear? Is your breathing normal? Is your heart racing? If you feel dizzy, wait. Do not push through it. Step 4, drink water. Take a few slow sips from the glass beside your bed. Room temperature water is fine. You do not have to rush. Step 5, stand slowly and wait. Stand up with control. Hold the bed, wall, or nightstand if needed. Then stand still for 10 seconds before walking. This is the part people skip. They stand and immediately move. Do not do that. Stand first. Wait. Then walk. That is the 90-second routine. 3 breaths. Ankle movement, sit before standing. Drink water, stand and wait. It sounds simple because it is simple. But simple does not mean weak. Simple habits are often the ones people actually follow. Now let me tell you a story. A man I'll call Daniel was 69. He was careful with his health. He took his blood pressure medicine. He walked most days. He tried to eat well. But every morning he had the same habit. Alarm, sit up fast, stand fast, bathroom, coffee, no pause, no water, no breathing. He told me I get dizzy sometimes, but it goes away. That sentence matters because the body often whispers before it screams. So I asked him to try one change. Not a new medication, not a new supplement, just the 90-second routine. 3 weeks later, he told me, I still wake up slowly, but I don't feel like I'm fighting my body anymore. That is the point. You are not trying to make your heart work harder in the morning. You are trying to help it. Now, the 4th morning mistake is checking your phone immediately. This may not sound like a heart habit, but it can be. You wake up before your body has even adjusted, you grab the phone. Messages, news, bills, family stress, bad headlines, work problems. Suddenly, your brain is awake, your stress response is awake, and your body is still lying there trying to catch up. Stress can raise heart rate and blood pressure. So why begin the day by shocking your nervous system? Give your body 90 seconds before the world gets access to you. No phone first, no news first, no arguments first. Your first job is not to answer the world. Your first job is to help your heart enter the day safely. So place the phone away from the bed if you can, or at least promise yourself water and breathing before phone. Now, the fifth mistake is skipping your morning blood pressure clues. Many adults over 60 have blood pressure issues and do not know what their morning pattern looks like. Some only check at the doctor's office, some never check, some check randomly and do not write anything down. But if you often wake with headaches, dizziness, pounding heartbeat, chest pressure, unusual shortness of breath, or blurred vision, you should speak with your doctor. Do not guess, do not assume. Do not say, it's just age. Your morning symptoms are data. They are clues, and clues are useful. The American Heart Association includes healthy sleep as part of life's essential 8 for heart health and says adults should aim for 7 to 9 hours of sleep on average. Sleep is not separate from heart health, it is part of it. So if your mornings consistently feel wrong, pay attention. Write down what you feel. Check your blood pressure if your doctor has advised home monitoring. Bring the pattern to your doctor. A pattern is more useful than a guess. Now let's bring this together. The morning can be a vulnerable time for many adults over 60. Your body is moving from rest to activity. Your blood pressure is changing. Your heart rate is changing. Your fluid level may be lower. Your balance may not be fully ready. And if you stand too fast, rush to the bathroom, drink coffee before water, and check stressful messages before your body is ready. You may be making your morning harder on your heart than it needs to be, but the fix is not complicated. Tomorrow morning, do this. Do not stand immediately. Take 3 slow breaths. Move your feet and ankles. Sit on the edge of the bed. Drink water. Stand slowly. Wait 10 seconds. Then walk. That is your 90-second morning heart routine. And please remember this. If you have chest pain, sudden weakness, trouble speaking, severe headache, fainting, or shortness of breath, seek urgent medical help. If you often feel dizzy when standing, talk to your doctor. Orthostatic hypotension can sometimes signal a health issue that needs evaluation. This video is education, not personal medical advice, but it may give you the exact question to ask your doctor. Could my morning dizziness or blood pressure change be related to how quickly I stand up? That question matters. Now I want you to comment one word. Which habit do you need to change first? Type stand, water, bathroom, phone, or pressure. And if this video helped you, subscribe, because in the next video I'll show you the nighttime habit many adults over 60 do that may be making their morning blood pressure worse. I'm Dr. Marissa. Take good care of your heart this week. It has worked for you every second of your life. Give it 90 calm seconds tomorrow morning. You came here thinking your morning routine was harmless, but you are leaving with a safer way to wake up. You came here with a habit, you're leaving with a map.